CEN Exam Prep Book. Question 1. An epidural hematoma is most commonly associated with which mechanism of injury? Option A. Striking the head on a hard surface. Option B. Rapid deceleration injury. Option C. Injury to the temporal bone with laceration of the middle meningeal artery. Option D. Acceleration minus deceleration injury causing shearing forces. The correct answer is option C. Injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Question 2. Which of the following is a classic sign of a hip fracture in an older adult? Option A. Internal rotation of the affected leg. Option B. Shortening and external rotation of the affected leg. Option C. Adduction of the affected leg. Option D. Flexion of the affected leg. The correct answer is option B. Shortening and external rotation of the affected leg. A hip fracture typically presents with the affected leg shortened and externally rotated. The patient is unable to bear weight. Internal rotation, A, is more common in hip dislocation. Adduction, C, and flexion, D, are less specific findings. Question 3. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A. Apply fresh water to the area. Option B. Apply vinegar to inactivate nematocysts. Option C. Apply heat to the area. Option D. Rinse with seawater and apply ice. The correct answer is option B. Apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred.
Stressed about your FCLE exam? We can take FCLE exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option C. Respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 5. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A. Inability to abduct the fingers. Option B. Inability to oppose the thumb. Option C. Inability to adduct the thumb. Option D. Decreased sensation in the small finger. The correct answer is option B. Inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 6. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A. Hypokalemia. Option B. Hyponatremia. Option C. Hyperkalemia. Option D. Hypercalcemia. The correct answer is option A. Hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 7. A 12-lead ECG has been completed on a patient who presents with chest pain. The ST segment is normal. Which new finding is most critical and requires prompt intervention? Option A, left bundle branch block. Option B, right bundle branch block. Option C, peaked T waves. Option D, inverted T waves. The correct answer is option A, left bundle branch block. New onset left bundle branch block, LBBB, in a patient with chest pain is a critical finding that can mask acute ST-segment elevation myocardial infarction, STEMI, on ECG. The presence of new LBBB with chest pain is considered a STEMI equivalent and warrants immediate reperfusion therapy. Right bundle branch block, B, is less concerning and often benign. Peaked T waves, C, may indicate hyperkalemia but are not as immediately critical as new LBBB in this context. Inverted T waves, D, can indicate ischemia but do not necessitate the same urgent intervention as new LBBB. Question 8. In a mass casualty incident, which patient would be classified as green minor, according to START triage? Option A. A patient with a fractured femur, respirations 20/min, pulse 100, able to follow commands. Option B. A patient with an open fracture of the tibia, respirations 24/min, pulse 110, able to follow commands. Option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. Option D. A patient with a large scalp laceration, respirations 22/min, pulse 100, confused. The correct answer is option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. In START triage, green minor, patients are those who are walking and have minor injuries. The sprained ankle patient who can walk is green. Fractures, A, B, are typically yellow delayed. Confusion, D, is a concern and may indicate need for more urgent care.
Are you looking for FCLE exam actual questions? Visit our website pokerexams.com to access FCLE exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get FCLE exam answer key today.
Question 9. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A, return to the waiting room in line of sight of the triage nurse. Option B, resuscitation bay to prepare for intubation. Option C, isolation room on droplet precautions. Option D, isolation room on airborne precautions. The correct answer is option D, isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 10. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A, respiratory rate of 24 breaths/min. Option B, altered mental status. Option C, temperature of 101.5 degrees Fahrenheit. Option D, WBC count of 15,000. The correct answer is option B, altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24, A, is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 11. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Bachnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24–48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Bachnella corrodens, D, is associated with human bites. Question 12. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the option A, femoral artery, option B, sciatic nerve, option C, popliteal artery, option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 13. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B, obtain a lateral neck X-ray. Option C, administer nebulized epinephrine. Option D, administer 4 antibiotics. The correct answer is option A, assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Question 14. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, Bun/CR ratio 20:1. Option B, Bun/CR ratio 10:1. Option C, normal Bun/CR ratio. Option D, elevated CR with normal Bun. The correct answer is option A, Bun/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the Bun/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1, B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 15. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A, continuous nebulized albuterol. Option B, oral corticosteroids. Option C, 4-magnesium sulfate. Option D, immediate intubation. The correct answer is option A, continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 16. Which of the following ECG findings is most consistent with pericarditis? Option A, ST- segment elevation in all leads with reciprocal depression. Option B, diffuse ST- segment elevation with PR- segment depression. Option C, ST- segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST- segment elevation with PR- segment depression. Acute pericarditis classically presents with diffuse, global, ST- segment elevation across most leads along with PR- segment depression. The ST- segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 17. A patient is diagnosed with a UTI and prescribed nitrofurantoin. What is an important patient education point? Option A. Take the medication with milk. Option B. Complete the entire course of antibiotics. Option C. The medication may turn the urine bright orange. Option D. Avoid foods high in tyramine. The correct answer is option B. Complete the entire course of antibiotics. Completing the entire course of antibiotics is essential to prevent recurrence and antibiotic resistance. Nitrofurantoin should be taken with food, not milk. A. It may cause brown or rust-colored urine, not bright orange. C. Tyramine avoidance, D, is important for MAOI medications. Question 18. The possibility of an ectopic pregnancy increases when a patient has a history of Option A. Breast cancer. Option B. Endometriosis. Option C. Teenage pregnancy. Option D. Pelvic inflammatory disease. The correct answer is option D. Pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A. Naloxone. Option B. Flumazenol. Option C. Naltrexone. Option D. Methadone. The correct answer is option A. Naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenol, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 20. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A. Hyperthyroidism. Option B. Hypothyroidism. Option C. Diabetes mellitus. Option D. Cushing's syndrome. The correct answer is option A. Hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 21. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A. Assess fetal heart rate. Option B. Obtain maternal vital signs. Option C. Prepare for emergency delivery. Option D. Perform a pelvic examination. The correct answer is option B. Obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the third trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out. Question 22. A patient presents with organophosphate poisoning. Which symptoms would the nurse expect? Option A. Pinpoint pupils, bradycardia, excessive salivation. Option B. Dilated pupils, tachycardia, dry skin. Option C. Constricted pupils, tachycardia, dry mouth. Option D. Pinpoint pupils, hypertension, excessive salivation. The correct answer is option A. Pinpoint pupils, bradycardia, excessive salivation. Organophosphate poisoning causes cholinergic crisis with muscarinic effects, meiosis, pinpoint pupils, bradycardia, salivation, lacrimation, urination, defecation, and bronchospasm. Dilated pupils, B, is seen with anticholinergic poisoning. Dry mouth, C, is seen with anticholinergic poisoning. Hypertension, D, is less characteristic. Question 23. Which of the following is a priority intervention for a patient with priapism? Option A, administer pain medication. Option B, apply ice to the genital area. Option C, prepare for surgical intervention. Option D, administer oxygen. The correct answer is option C, prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Question 24. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A, do you have a plan? Option B, what medications do you take? Option C, do you live alone? Option D, have you attempted suicide before? The correct answer is option A. Do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly. Question 25. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A, ectopic pregnancy. Option B, ovarian torsion. Option C, pelvic inflammatory disease. Option D, appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain.